Hi, everyone. This is Beth Rogan. I'm the Associate Director of Marketing and Outreach here at William James College to welcome you to our What is Behavioral Medicine and Health Psychology webinar. Thank you so much, you all, for joining us this afternoon. Really excited about this sort of specialty webinar that we have today to talk about these area and concentration, an area of emphasis in behavioral medicine and health psychology. I will be your host today, and what that really means is I'm just going to be providing a little bit of an overview about William James College and also managing some questions for you. So with that, I'd like to move on to our next slide. And I'm really excited and happy to be able to present today Dr. Allyson Cherkasky, who is the Area of Emphasis Director for Health and Behavior Medicine. And she is an associate professor as well in the counseling department here at William James College, as well as excuse me, Dr. Carolyn Rabyn, who is the director of the health psychology concentration and an associate professor in our clinical psychology department. So they will be coming on shortly, and they'll be telling you a little bit about themselves and their programs. And again, I'm Beth Rogan, and Joe Lush is our Associate Director of Admissions here at William James College. He's also going to be helping us with the technical side today. So thank you very much, Joe, for that. And he'll be presenting some information on things to think about when you're applying to graduate school, and in more particularly here at William James College. So he has some really good tips and information for you a little bit further on in the program. Next slide, please, Joe. This is one of my favorite slides. It's a facade or a picture of William James College. And for those of you who don't know, we are located in Newton, Massachusetts. We're right outside of Boston and about 15 minutes in non-rush hour. That's my disclaimer, to downtown Boston. So we're in a great location. It's actually really very convenient for our students and all of us to get on and off campus. We have free parking, tons of parking, so that's also a nice little plus. We're right next to this beautiful location on the Charles River, but it's really what's inside the building that's so superior, and that is the culture. The culture, as well as our practitioner faculty and professors who are amazing, our students who are just so they're just a wonderful group of students here at William James College doing really important work with many different interests in our community of in administration and staff as well. So it's a wonderful place to an organization to be part of, and institution of higher learning to be part of as well. And with that, I'll move on to the next slide. And it's part of just a little bit of an overview. I wanted to give you some information about the core values here at William James College. You may have heard this already, so I'm gonna say it again because it's so important to us that really helps to set us apart from many institutions, and again helps to form the culture that's inside the building and part of us. So experiential education is really the hallmark of most of our training here at William James College. Our students generally start the first week, and they do in both the programs you're going to hear about today, in their practicum as well as their coursework, and then there's a seminar class that really bridges the two. So what students are learning every day in their classroom or every week, they're applying in their field placement and their experiential education, and so they're applying what they're learning, and it's a really powerful model of pedagogy. So that's one of the areas that is our core values, and with that experiential education, we have an enormous and very busy field education department, and there are dedicated individuals in that field education department for each department, academic department, so that to help and support our students finding the field placement site that's right for them. In terms of social responsibility, it's really key to our mission at William James College. We look to meet the need and make a difference. And one of the ways we're looking at doing that is to really equip our students throughout their academic career here to be culturally sensitive, to be able to really work and have that sensitivity for diverse populations, but we're also looking to equip our students to be trained to meet the needs of diverse populations that are underserved. So we have many um, concentrations that are called our college-wide concentrations that address this issue or beginning to address the issue. So within our Center for Multicultural and Global Mental Health, we have a Latino mental health program. We have a African and Caribbean mental health. Our newest concentration is Asian mental health, as well as global mental health, veterans and military psychology, Black Mental Health Academy. And so those areas, our students from the counseling department and from the clinical department can also be part of those concentrations if they are interested. And they have some really wonderful immersion programs that are associated with that. So that's one way among other ways, including advocacy and so forth, that we are really addressing that need. In terms of personal growth, is something that's really important. And of course, as a student coming in, it'd be very important to you, and our students do grow exponentially every day. One of the ways that happens is that we have practitioner faculty. And what that means is that our faculty are um, they are clinicians, they are doers, they are practicing or have practiced. So they really have and bring many, many expertise with them. And again, that provides mentorship and a wonderful training program. And we also at William James College are faculty have a ratio of 12 students that they're advising, so it's 1 to 12. And with that, you are not a number. You definitely are very well known by your faculty. In addition, as I mentioned, social responsibility, again, we have a very strong commitment here to diversity, inclusion, and again, the social responsibility and justice and intercultural understanding. And with that, we'll move on to our next slide. And this is the housekeeping slide where you can see you have access to ask questions, and we really encourage you to do that, as it really makes this webinar your webinar, and it helps to create a more engaging conversation. So please type your questions in the question box, and we also have the PowerPoint is located in your handout section, so you can download that if you would like. And our next slide is where I'd like to now introduce you to our presenters. Thank you.
Great. Hi, everyone. My name is Dr. Allyson Cherkasky. I want to extend a warm welcome. I'm thrilled that you're here, and we're really excited to be talking about health psychology and behavioral medicine. Just want to give you a little bit of a background. I was always interested in the mind-body connection, and I was fascinated by um, how to understand what people could do to optimize their health, and understanding kind of the behavioral piece and the physiological piece, and how to teach people how to be as healthy as possible. So I did my PhD in clinical psychology, and I did a track in health psychology when I was in graduate school, and then had the privilege of working in a bunch of different settings. I did some training at a rehab um, hospital. I also worked at the VA, and then trained in hospital settings as well. and my advanced training was in behavioral medicine. And then I went on to develop some expertise in eating disorders and obesity medicine. So I've had the privilege to work in group practices, private practice, and hospital settings, and now teaching. So I'm going to pass this over to Dr. Rabyn.
Thanks, Allie. This is Carolyn Rabyn. I'm really excited to have the chance to talk to everybody today. Just listening to Dr. Cherkasky's description of her background is actually not so different from my own. I also did a PhD in clinical psychology with it wasn't a formal concentration, but sort of a focus on health psychology. And then following that, did my APA internship in a behavioral medicine track. So that was very much focused on developing different behavioral medicine, health psychology skills in different settings. So I worked in a medical hospital and in a VA and in outpatient clinics. Following that, I did a postdoctoral fellowship actually at the same site. So that my internship was in Rhode Island at one of the Brown University hospitals. And I stayed there for my postdoc doing a focused experience on cancer survivorship. And that's really become, that's one of my big areas of interest and something that I continued for many years after that. So I actually stayed on there in Rhode Island following my postdoc, doing in a faculty position that was also focused on developing programs to help cancer survivors with their recovery, essentially their life after cancer. So we were developing and then testing out some stress management programs and exercise programs actually for this population. And I really loved it. The one thing I felt I was missing was doing more teaching. And that's actually what brought me to William James College, where I started a position this is my 6 years, about 5 years ago. And I came to teach courses and also actually to direct the health psychology concentration within the PsyD program. So I'll tell you a little bit more about that a little bit later on, but I want to hand things back over to Dr. Cherkasky.
Thank you. Next slide, please. All right, so to start with, we're going to just go over some definitions, some terms, and then I'm going to break it down. So what are these terms anyway? So health psychology, clinical health psychology is defined as the application of psychological theory to the promotion and maintenance of health, to wellness, and to ameliorating the challenges of maladaptive health behaviors and acute and chronic medical illnesses. Behavioral medicine is defined as an interdisciplinary field concerned with the development and integration of behavioral and biomedical science knowledge and techniques relevant to health and illness, and to its application to prevention, diagnosis, treatment, and rehab. I want to break that down because that might seem like a little bit of gobbledygook. So in a nutshell, when I think about health psychology, I think about it as a broad rubric, and there's a lot of things that fall under it. So that could be geropsychology and neuropsychology and oncology and rehab and a bunch of different subcategories. Clinical health psychology, the application of those things. Behavioral medicine, the way I think about behavioral medicine, I'd like to break it up into just a couple different areas. I think about the first one is interventions. So these are specific skills and strategies and treatment approaches that are targeted to specific populations. So the populations can be it can be a general mental health condition like depression or OCD or grief or anxiety, or it can be an acute or chronic medical condition. And then the goal of these interventions is to improve a person's functioning. So if we could have the next slide, please. So I like this slide because it gives you a picture of major causes of death right around 1900 and then 100 years later during the year 2000. So we often in the field, we talk about morbidity and mortality, morbidity being disease and mortality being death. So we look at the major causes of death. If I were to ask you what you notice, so at the 1900, we see cardiovascular events, influenza, pneumonia, tuberculosis, diphtheria, measles, you can see them. And then if we go over to 2000, we see some overlap, but some shifts as well. So we see cardiovascular, cancer, cerebrovascular disease, COPD, accidents, et cetera, et cetera. If I were to ask, so I don't know if we can take a poll now. I'm not sure that we can. So I'll share some thoughts. But if you were to look at some differences, the main things are that, except there's one caveat, we have the coronavirus, which I can address momentarily. But if you were to look at the main things, in 1900, a lot of these had to do with infections. And so infectious diseases and with the with antibiotics and the discovery of penicillin and other antibiotics, a lot of those have been eradicated. So if we look at now, a lot of the primary causes of death have to do with illnesses where there's a primary behavioral component. So when I say behavioral component or lifestyle component, those are things like diet and exercise and significant stress and smoking and drinking and obesity and how those impact these disease state. The only thing that, of course, we would add right now is the coronavirus. But what's interesting, even though that's an infectious disease and we're, thank goodness, much closer, it looks like, we have a vaccine now, there are still a behavioral component. So those are the public health aspects, wearing the mask, socially distancing, and hand washing. So next slide, please. So another thing that we talk about when we think about health psychology and behavioral medicine is really at the heart of it is the biopsychosocial model. So George Engel in 1977 came up with this term, and the way he defines it is as follows. The biopsychosocial model refers to the idea that biological, psychological, and social processes are integrally and interactively involved in physical illness and health, medical diagnoses, and medical treatment and recovery. Prior to this, and I'm sure you've probably heard through, in perhaps college courses that you've taken or things that you've read, mind-body dualism. So really, up until relatively more recent times, there was this split and this dichotomy that something was either in your mind or in your body. And so now what we know is everything is interrelated and each variable impacts the other. So they're inextricably intertwined. So if we look at a biopsychosocial model, it's looking at all of the biological factors. And here I name a few under each, but I want to be clear, I could give 20 examples under each. So for biological factors, these are things like genetics, immunity, neurochemistry, nutrition, substances, medicines, we could go on. Psychological factors, these are things like our cognitions, our temperament, which could also be biological, um, our family environments, behavior. When we look at social factors, these are things like um, our systems, our broader systems, our social network, our culture, the context of our lives, socioeconomic status, all of these variables. Next slide, please. So how are these variables related to physical health? So we know that illnesses and disease states, they're not a single entity. These are multi-determined rather than caused by a single factor. And we know that when we help people change in one domain, it has implications for others. And so I'll give you an example. If someone doesn't have adequate nutrition and we work on that piece, their mood is going to be better, their cognition is going to be better, their mental status is going to be better, their health status is going to be better. And we can take each aspect of the biopsychosocial model and think about tweaking different things. So if someone has an illness and they go on the right medication, that's going to spiral and help them to feel better. If we make sure that, if people have healthy relationships and have their basic needs met, that spills into all of those other realms too. We could all come up with hundreds of examples on how each of these concentric circles are interrelated and influence each other. So it's a more comprehensive model. It's an integrative approach that really addresses the whole person and the context of the person's lives and leads to better prognosis and health outcomes. Next slide, please. So this is a slide on stress, emotions, and coping. And rather than going through this, I'm just going to say a couple things. Um, we know that stress has a powerful influence on the brain and the body and every organ system. So there's different types of stress. There's an acute stress, and our bodies are really wired to. It has a role that is. It preserves us. It's life preserving. So we know if there's an emergency, we need to react to it. And you've probably heard of the fight or flight model. But then there's the daily stressors, there's ongoing stress, and those stressors really are not adaptive, and over time they cause wear and tear and can impact us um, on multiple levels and culminate in a disease state. So one of the things that we do in the world of health psychology and behavioral medicine is we teach people about the stress response, and we teach them specific skills and strategies to reduce stress. So we can call it stress management or reducing physiological arousal. But what's really fascinating is as people learn these strategies, they can turn off that alarm system in the body and significantly improve their health and their overall functioning in mind and body. Next slide, please. So I'm going to hand this over to my colleague now. Thank you.
Thanks so much, Dr. Cherkasky. So shifting now to think about who we work with or who we serve. If we have a background in health psychology or behavioral medicine, it really is a very broad and diverse group. So thinking in terms of age, we really work with people across the lifespan. So we have some people doing pediatric psychology work, working with children, people working with adolescents, adults, and the elderly, so older adults as well. And you can see on this slide, this is certainly not an exhaustive list, but the range of different types of issues, medical and mental health issues, that somebody with a background in health psychology and behavioral medicine might be working with or treating. So you see things that are more kind of classic mental health issues like mood and anxiety disorders or trauma-related disorders. And then you see a whole range of different medical disorders. So GI issues like Crohn's disease and colitis, breathing related issues like asthma and COPD, various forms of cardiovascular disease, different cancers, and so on. And I'll be talking in just a minute about the different types of interventions we might offer. But there are just a whole range of different ways that we can work with these populations and help them. First of all, both in terms of prevention, so helping people change their health behaviors before they're ever even diagnosed with something. So if somebody's maybe at high risk, for example, for diabetes or heart disease, we might help them make changes to their diet or become more physically active in order to prevent a medical diagnosis down the road. Or if somebody does have a medical condition or diagnosis, we might help them with their emotional adjustment to what it's going to mean to have that illness. And we also might help them, again, make some behavioral or lifestyle, lifestyle changes that can help really optimize their health going forward. We also might work with them around different symptoms that are impacting their quality of life. So things like being in pain or experiencing chronic pain or ongoing fatigue, those kinds of physical symptoms that can be addressed or aren't always addressed adequately through medical interventions. Sometimes a behavioral health provider can offer some interventions that can make a patient more comfortable. Next slide. So given that huge range, it's probably not surprising then that we also work in a whole range of different settings. So sometimes this work is done on in an outpatient mental health clinic, either a private practice or maybe a community-based mental health clinic. Sometimes it's done in hospitals, either teaching hospitals or community hospitals, or it might be done in a medical specialty clinic. So for example, a pain clinic that, again, offers perhaps both medical interventions and also behavioral interventions. In fact, one of our very popular field training sites for doctoral students is with the Boston Pain Center, where students spend a whole year just learning different techniques, behavioral and cognitive techniques that they can use to help people who are trying to manage chronic pain. So that's another type of setting. And we also have, there are cardiac rehabilitation clinics that use, either psychologists or counselors to work with their patients, bariatric surgery clinics, and so on. And then another really expanding area for people with a background in health psychology or behavioral medicine is primary care clinics. So I'll actually talk a little bit more about that in just a minute. But there are also, opportunities to work in school settings or academic institutions, as Dr. Cherkasky and I do, or to be part of a research team, perhaps offering the clinical intervention to participants in a research study that's trying to test out whether a new treatment might be superior to the treatments that we already have been using for a particular medical disorder. Could you, next slide, please? Thanks. And then in terms of what we do or how we offer our services, there are really a number of different ways that we can ultimately benefit these different populations of patients. So certainly some of it is direct clinical work, either with an individual or perhaps a couple or family unit. Sometimes the work is done in groups, and you can imagine, for example, if somebody has a medical illness, perhaps one that's not as common, it might be very helpful for them to gather with other people who are going through the same experience as more of a, kind of a group treatment or group therapy or support group. So they benefit both from working with a clinician, but also from being with and talking to people who are going through the same experience. So that's all kind of the direct clinical work. But we also have a role in working with medical providers. So sometimes we can benefit even a larger population of patients by providing some education or training to other providers. So for example, maybe teaching a medical provider about strategies that they can use to help their patients, their medical patients, being kind of adhering to the medical regimen. So, giving them some tips like that, maybe some behavioral tips that they can pass along to the patients they work with. There's a lot of interdisciplinary work, a lot of collaboration with other healthcare providers that goes on in this area of clinical psychology. Again, some of that is kind of more along the lines of education. Sometimes it's advocating for patients if the providers maybe aren't as aware of some of the psychological or emotional health issues that go along with the illness that the patient is dealing with. And then there are other settings in which there's an opportunity to do a lot of wellness promotion. So for example, if you were perhaps working in a college counseling clinic with that college population, you might be designing and running some health promotion programs on campus to help encourage healthy eating or exercise or safe sex practices, things like that. So again, there are a number of different roles, certainly roles in academic institutions, teaching, in some cases research, or program development. It really is, even though health psychology and behavioral medicine is kind of an area within, within clinical psychology and within counseling, it really does have a lot of different opportunities and a lot of flexibility to it. Next slide. So I want to just talk about one of those opportunities because, again, it is an area that I feel like is really expanding in terms of job opportunities. And I've already seen a number of the graduates from the PsyD program go into this area and really enjoy it. And this is the area of integrated care. So more and more, I think there's greater and greater recognition of the benefits of having somebody right in a medical clinic who has expertise in mental health and in health psychology and behavioral medicine strategies. And there are a number of reasons for this, and that's what this slide is trying to kind of detail. So certainly there are many behavioral health issues that medical providers would like some help with addressing. And part of the reason for that is that there are a number of patients who don't necessarily feel comfortable going to a mental health provider, but they might disclose to their primary care physician that they've been struggling with feeling down or depressed, or maybe that they've felt very anxious. And they might even be just looking for a medication, but their healthcare provider, their medical provider might realize that they would benefit from working with somebody who has a mental health background. So there's a lot of opportunity there right in the primary care setting to really give patients access to mental health providers that they wouldn't maybe seek out on their own. So again, a number of behavioral health issues like mood issues, or sometimes things like sleep issues or substance use issues come up during the encounter with the primary care provider. So that's a good reason, again, for having somebody right on site as part of the clinic who might be able to address that. And then we also know that when people are dealing with medical illnesses, they're at higher risk for having a mental health issue as well. So it kind of puts you at risk for depression or anxiety. And that's true of a whole range of different medical illnesses, including the ones listed on the slide. So diabetes, heart disease, cancer, asthma, etc. So given that, again, it just makes good sense to have somebody as part of the healthcare team in primary care who has expertise in addressing those kind of mental health issues. And we also know that there are a lot of patients that will come to primary care with sort of vague symptoms that might get worked up and never really diagnosed as anything. So ongoing pains or feelings of, fatigue or dizziness. These things we tend to label unexplained medical symptoms. And it may be that some of those can be addressed. They may be related to stress, or that it's possible that they're kind of a byproduct of maybe a mental health issue. Even if not, having an unexplained medical symptom can also be a stressor. So it's oftentimes very helpful to have patients who are, seen oftentimes multiple times in a primary care setting for those kinds of symptoms to ultimately work with the behavioral health provider. So again, there's a kind of expanding recognition of the value that somebody with a background in health psychology or behavioral medicine can provide, even right in the medical setting. Next slide. And then in terms of the types of interventions we offer, I'm not going to go through and describe all of these, but this just gives you a sense that there's really quite a big range. There are all sorts of different relaxation strategies that we can teach our patients. There are a number of empirically supported interventions that we can use to help people changing lifestyle behaviors like exercise and, helping them, improve their nutrition. There are also some great interventions to help with sleep and so on. So there's really a whole range of options that we have to work with these populations. Next slide. And now I'm going to hand things back over to Dr. Cherkasky to talk about the master's program emphasis.
Thank you so much. So I want to talk a little bit about this emphasis area in the Counseling and Behavioral Health Department. So folks that go into our program, it is 2 years, and you are training to ultimately become a licensed mental health counselor. So it's a master's in clinical mental health counseling. After you graduate, you will accrue postgraduate supervised hours, you'll pass your exam, and you'll be a licensed mental health counselor. The emphasis area is a 3-course sequence that I'll talk about momentarily. But you'll have a core curriculum with all of the other students. So the vast majority of your classes, except the 3 in the sequence, are classes that everybody in the department has. Students have the option to do it. Here it says 2 years or 2 years full-time, including 1 summer, or 3 years part-time. But we've actually added a few other options, 2.5 years, 3.5 years. Students have a few different options. The first year, students are placed in the field, and we call that the practicum. And students are in the field for 2 full days, and then they're at school typically another 2 full days. And then the second year, assuming a person's going full-time, they will be in the field during their internship year 3 full days. And then in the class, the equivalent of 1 full day. And I will talk in a moment about the 3-course sequence in the health and behavioral medicine area of emphasis. Next slide, please. So the first thing that many students want to know, and to be quite honest, many colleagues are confused about this. We talk about different terms: behavioral medicine, health psychology, behavioral health. We already identified health psychology and behavioral medicine. Behavioral health is a term, it's a general term that basically refers to all of the emotional disorders, including substance abuse. So the last probably 5 or 7 years, there's been a move toward the term behavioral health. It's less stigmatizing than mental illness. Behavioral medicine, as I mentioned before, the way I think about it is these 3 parts: the interventions, and as Dr. Rabyn talked about, there's a multitude of skills and strategies that we teach people, and we apply it to specific populations with the goal of improving their functioning. Next slide, please. Okay, so if we could just flip through, if you could just press a bunch, there you go. Thank you. If you could just keep going. Thank you so much. So I already talked about the biopsychosocial model. I talked about I spoke about the stress response, and we talked about health promotion and disease prevention. And my colleague also mentioned we incorporate a lot of different strategies, and you may have heard the term evidence-based practice or empirically supported treatment interventions. What I like to talk to my students about is it's really building a toolbox of many skills and strategies and being able to think in an integrative model. So it's not taking a linear perspective, but really thinking about many different treatment approaches, understanding what is an evidence-based, is there an evidence-based practice or best treatment specialty guidelines for this population, but really thinking broader about who is this individual, what do they need at this time, and what can I provide in this particular setting? So, for example, if someone is being seen long term on an outpatient basis, that's different than in a primary care setting where I might see someone for 1 to 5 sessions for 30 minutes. So, um, we also cover in this concentration, the first course is kind of an introductory course that covers a lot of different content, and then we go into the second course, which is treatment interventions. But everything is embedded in culture and context and appreciation of diversity and difference. We take a public health perspective and we look at social determinants and disparities. And what I mean by social determinants, those are societal factors, the things like socioeconomic status, racism, discrimination, neighborhood environments, daily stressors. Um, all of these things have a direct bearing on health and disparities in health. Okay, next slide, please. And as my colleague talked about, interdisciplinary teamwork is key. Okay, I'm not gonna go through in this one in as much detail, and if I could actually have the yes, perfect. If you could just hit all those, because my colleague mentioned them, and everything that Dr. Rabyn mentioned applies to the master's program as well, in terms of just working in multiple settings and with multiple populations. Next slide, please. Okay, just want to talk for a moment about the difference between a master's degree and then going on to get a PsyD degree. There's considerable overlap in terms of what you will be able to do and where you'll be able to work. With both degrees, you can work in private practice and bill insurance companies, and you can work in medical specialty clinics as an embedded behavioral health clinician. You can work in primary care. You could hold leadership positions, and you can teach. But a couple distinctions: you cannot teach at a doctoral level without a doctoral degree. A doctoral degree is going to give you more experience doing research. Um, with a master's, you'll be done in 2 years. So things you want to think about: investment of time and energy and money are variables. Um, What's different with a doctoral degree, obviously, it's a few more years, it's additional coursework, you're getting more clinical training, and which allows you to delve deeper. If you want to do neuropsych testing or comprehensive psychodiagnostic assessment, you need a doctoral level degree, as I mentioned, teaching. And higher level admin positions at teaching hospitals, you would need a doctoral degree, and also there are higher salaries as well. What I just want to quickly mention is that when somebody calls me for a referral, I do not think about degrees. I think, who's going to be the best clinician for this person? And I think about things like professionalism and ethics and intellect and um, commitment to the client and who might be the best fit. So I just wanted to mention that. And now I'm going to hand it over to Dr. Rabyn. Thank you.
Thank you. And if you could move on to the next slide. So as I mentioned before, I direct the health psychology concentration that's within the clinical psychology PsyD program. So this is the doctoral program. So I outlined the requirements for that concentration, and I'll just briefly describe them, but certainly please ask if you have any more detailed or specific questions about the concentration. So in terms of the course requirements, you have, if you're enrolled in the doctoral program, you have a number of required courses. It's a 5-year program. Most of the courses are taken during the first, first 4 years, but really the bulk during the first 3. And you also have some elective credits. So you have some credits that you can choose how you use them and spend them. If you're in the any one of the concentrations, you'd be using some of those elective credits to take courses that focus on the area of concentration. So for health psychology, there are 3 specific health psychology courses that you'd be required to take. So again, this wouldn't add to the number of courses you take for the program. It just means that you'd be using some of your elective credits for those courses. And then in addition, I ask that you, excuse me, choose one course that I call a health psychology elective, which is essentially choose another elective course that in some way relates to health psychology, but you can tailor that to what you're most interested in. So for example, we have a course, an elective course on pediatric psychology. So for students who are interested specifically in working with children who have medical issues, that's a great choice. Or we have a course on geropsychology for students who are particularly interested in working with older adults. And there are a number of other choices as well. In terms of the clinical training or field placement training requirement, students in the concentration are required to do at least 1 year of clinical training at a site that's been designated as a health psychology training site. And in just a moment on the next slide, you'll see some examples of where that might be. And then in terms of, then we have, as part of the doctoral program, every student does a doctoral project. So that's a 2-year-long research project. And the students select the topic within some area of clinical psychology. If you're in the health psychology concentration, you'd want to pick a topic, or you'd be required to pick a topic that in some way relates to health psychology. So sometimes students focus on a particular medical population. They'll look at an area of interest among people who have diabetes, for example, or I've had a few students do projects on Lyme disease. Or you might do something on health-related behavior, so something related to exercise or sleep or diet or something like that. And you'd also have, we have students put together a little committee of 2 faculty members who help guide the project. And if you're in this concentration, you would select at least 1 faculty member for your committee who has expertise in health psychology. Next slide. So again, just to give you some idea of the kinds of training options you have if you're interested in health psychology. This is not a full list, but these are some examples of the training sites where students do training that's related to health psychology. So all these have been designated as fulfilling that health psychology training requirement. And you can see there's really a range. So there's a wonderful training opportunity down in Rhode Island at the Hasbro Children's Hospital. There are also a number of community health and medical centers where students learn integrated care, again, just along the lines of what I was talking about a few minutes ago, where they're working alongside the medical team. And then we also have some training at specialty medical centers, so the Tufts University Boston Pain Care and Shriners Burn Hospital for Children. So really just a range of different options. Next slide. And then I also just wanted to give you an idea of some of the positions that our alums have taken on their way out of the program. So oftentimes students graduating from the doctoral program will go on to do a postdoc fellowship. And we've been really, the students have been really successful in finding some great postdoc opportunities, sometimes in outpatient clinics like the Kersner Associates Clinic that, at least for a while, had a division focused on integrated primary care. Sometimes our students will work in a hospital setting like MGH, or as part of a large healthcare organization like Harvard Vanguard. Or others have gone on to work at the VA. There's really a whole range of different opportunities within this area of health psychology that they have found upon graduation. And that's all I have on the health psychology concentration. So I guess I will turn it back over to Beth.
Thank you, Dr. Rabyn and Dr. Cherkasky. This is a really amazing presentation with so many details. And we don't have a lot of questions, but one is around, declaring or the process of declaring the concentration, and when does that usually happen?
So I can answer. In the master's program, we ask that people declare it by the beginning of the spring semester, because that's when the first course begins.
Okay.
And can I just jump in about the doctoral program?
Yes, please.
Okay. Sorry, I didn't mean to cut you off. Yeah, so in the doctoral program, I asked students to declare, actually, I think today is the day. So it is beginning of November 10th, I believe, of their second year. So you do have a little bit of time after starting the program to, figure out if this is a good match for you.
Okay, great. Okay. And there's a question of, do you need a master's to apply to the PsyD program? Either Dr. Rabyn or Joe, would you like to answer that question?
Sure, I'd be happy to chime in here, Beth. The vast majority of our candidates for the clinical PsyD program are coming into the program having just earned a bachelor's degree. So they're either in the final year of their bachelor's program, or they've been away from their bachelor's program for perhaps a year or two, and they've had some relevant work in the human services field. So a master's degree is not a requirement. Only about 15% of the candidates who apply for admission to the clinical PsyD program are coming in with a master's degree. If you do come in to the doctoral program with a master's degree in clinical mental health counseling or counseling psychology, there is the possibility of you coming in with a status known as advanced standing, which means a more generous transfer of credit into the doctoral program from your master's degree, and a waiver of the first year field training hours that a first year doctoral student would normally complete. But bottom line is that the expectation for admission to the doctoral program is that you only need to complete a bachelor's degree.
Okay. All right. At this point, that is all the questions that we do have. And we have a minute or two more if anyone wants to put any more questions in the question box. Is there anything, Joe, that you wanted to add right now before we move on, or did you have any particular slides that you wanted to use?
Yeah,
Okay,
I
great.
think what we'll do here, Beth, is move on to the admissions part of the presentation. So I just want to welcome everyone, and I want to speak to those of you who are attending today who might be thinking about an application to William James College. So I just want to offer a brief overview of the application process that you would follow for becoming a student here, and then I'll also outline for you the basic contents of your application portfolio. So before we talk about the basics of preparing an application portfolio, I just want to offer a quick overview of the key measurements of readiness that we consider when we're evaluating the credentials of a candidate. So on the slide that you see in front of you now, you'll see a summary of the key measurements of readiness for which we will consider both the credentials that are a part of your application portfolio, and then later what we'll do is we'll incorporate into our overall review of readiness the outcome of your interview. And so the common measurements of academic readiness will be the candidate's undergraduate grade point average, and then we'll also look at the overall strength of the application essay as it relates to the usage of grammar and sentence construction. Writing skills are very important. It's a very important element of being successful in training programs such as ours. So we're looking very carefully at your essay in terms of giving us some indication of your writing capability. And we're also going to be looking at the applicant's references to the extent that those references strongly endorse a candidate's academic readiness. And so for the two programs that we've been talking about today, the Clinical Mental Health Counseling Master's Program and the PsyD program, we're going to ask for 3 references. And for those of you who are soon to be graduates of a bachelor's degree program, or if you've just recently completed a bachelor's degree, the obvious and natural source of a reference is going to be one of your professors from your bachelor's degree program, possibly a department chairperson, also supervisors of a practicum or an internship that you had as part of your bachelor's program. Those sources make for really good references to speak on behalf of your readiness. And then for the interview, this activity also plays a major role in determining the outcome of your candidacy, and it also provides candidates with an opportunity to convey to your interviewer that you possess a high level of commitment to completing the degree program, and that you also have a basic understanding of the professional role that you aspire to become, and that you also possess the appropriate level of emotional maturity and interpersonal skills that are required for success in this type of career. So on this slide here, you'll see a basic checklist of items that will comprise your application portfolio. And our online application system will provide you with a detailed list of what documents are needed for either the master's or the doctoral program that you'll be applying to. And I would just ask that you check the website carefully and observe our application due dates. For the Clinical Mental Health Counseling Master's Program, we do have 2 entry points in the program. You can enter the program beginning in the spring term, or you can enter the program in the fall term. And for the Clinical Psychology Doctoral Program, there's only 1 entry point for that program, and that's for the fall semester. So for candidates for the master's program, you can join the program as early as this coming January, or you can join in late August of next year. For the PsyD program, you can join in August of 2021. And that's about it that I have for the application process. And in the interest of time, because it's almost 3 o'clock now, I just want to say that we're accepting applications right now through our online system for spring 2021 and fall 2021 enrollment. And if anyone has any questions about the application process, any technical questions, or if you'd like to have a conversation about your various credentials and how you would like to put all of those credentials together into an application portfolio, I'm happy to have a conversation with you and to kind of give you some advice and guidance as to how to put together your application. Okay, I'm going to hand it back over to Beth.
Great. And as you said, Joe, it's 3:01, so I don't know that we can stay on much longer, but there was a question around the samples of courses for either the master's or the doctoral program. So maybe we could have that the question answered by email in following up with this
Yeah,
for Amanda. That I think that might be maybe the easiest way to do that, so that both maybe Dr. Rabyn and Dr. Cherkasky could just send their sampling of the courses to, and we can follow up on that. Thank you so much, everybody. Joe, did you have something else you wanted to say?
sure. I was just going to speak to the attendee who raised that question about the curriculum. What I can do is I can send you a link to the curriculum map, and then you can view all of the course summaries in detail, and you can look at the sequence and the flow of those courses. So happy to do that.
Oh, great. Thank you so much, Joe. Okay, so we're going to be jumping off, but this is our contact information. Please feel free to reach out to anyone and follow us on social medias if you are if you are involved in social media. It's always a great way to get a sense of the college and the what we're advocating for here and just the activities that are happening. So I just want to thank our presenters today. Thank you so much, Dr. Cherkasky and Dr. Rabyn, and thank you, Joe, and everyone. Have a great afternoon.
Thank you, folks.
Bye
All
now.
best, everyone. Take care. Thank you.